I'm Denise. I'm going to be the nurse to see you today. Can you tell me what your name is?
I'm Tyler.
All right, Tyler, and how old are you?
15.
All right, excellent. So you are in for a head to toe assessment. So I'm going to start by asking you some questions and then we're going to move through the body systems. If at any time that you have any questions, just let me know. I'm going to be touching and listening to a lot of different spots. It doesn't mean that anything's wrong, it just means that we're going to be pretty thorough for you, okay? Do you know who the president is?
Donald Trump.
Good, okay. Do you have access to 3 meals a day?
Yes, ma'am.
All right. I see that you're nice and clean. I don't see any problems with your personal hygiene. Your posture is nice and straight. I noticed as when you walked in that you had a good gait. I did not notice any assistive devices. Do you use anything like a cane or a walker or anything like that? No? Okay, very good. Is English your natural language?
Yes, ma'am.
Okay. And do you, as far as your mood goes, you've been pretty happy so far?
Yes,
All right,
ma'am.
excellent, very good. And your BMI is pretty much equal to your height and weight, so very good. Okay, so we're going to go. Okay, I'm going to give a report on a 15-year-old male that came in for a head-to-toe assessment. He started off by stating his age, which is 15. He was alert and oriented ×3. He had a great nutritional status and access to 3 meals a day. His BMI was appropriate for height and weight. As he walked in, I noticed he had good mobility and good gait. There was no physical deformities or abnormalities, nor does he admit to having any deformities. His posture was upright and straight. He was in a good mood today. He also states he's pretty happy and stays in a good mood. His speech is, natural language is English, and he was nice and clean today. We started off with his skin, looked at his hair distribution, color, and was appropriate for his race. Warm and dry to touch. Hands were nice and clean. Nail beds were clean. Capillary refill less than 2 seconds. And his peripheral pulses, the brachial and radial, were also palpated. I moved up to his head, checked his scalp, which was nice and clean. No notice of infestations, redness or irritation or dandruff. His hair was dark brown and clean. His head was denies tenderness to palpation. No lumps, bumps, or bruises noted. I also moved down to his face. His face was nice and symmetrical. Cranial nerves 1 through 12 were all intact. Temporal artery was palpated. No thrills noted, and denies tenderness to maxillary and frontal sinuses. His neck, I went on and checked his neck at that point. He was negative for any pulsations, no lumps, bumps, or bruises, denies palpation, tenderness to palpation to the trachea or to the neck. All lymph nodes were palpated without tenderness and without swelling or enlargement. I checked his carotid arteries. Inspection, no lumps, bumps, bruises, or thrills. To palpation, one at a time. Were palpable, and auscultation, both bilateral sides, were without murmurs and thrills. I also checked his cranial nerve number 11, which is his range of motion and his muscle strength in his neck. He had full range of motion in his neck. I did move down to his eyes. His external structures were clear without irritation, eyebrows, eyelids, and eyelashes. His conjunctiva was nice and pink, and pupillary relaxation was equal and reactive to light and accommodation. Then I moved to his ears, external ears without drainage or irritation, denies tenderness to palpation. His nose was midline. Good patency bilateral, no drainage noted to the outside of the nose. The mucosa was pink and the septum was nice and midline. I moved down to his lips. His lips were not cracked, no irritation noted, no lesions noted. Mucosa, teeth, gums, tongue, hard soft palate, tonsils were all moist and without exudate. Thyroid was palpated. Non-tender and was not enlarged. Then I moved to his lungs, posterior inspection with AP to T diameter, scapula and spine midline, anterior inspection with no use of accessory muscles, and respirations were unlabored and were right at 16. Also, I checked his CVA tenderness when I was in his posterior check. He was negative for CVA tenderness, denies any tenderness to palpation. And I think I've mentioned before that his trachea was nice in midline and denies tenderness to that. Heart sounds sitting and lying were auscultated with no murmurs or no thrills. S1, S2 noted. Heart rate with regular rate and rhythm, and also the apical pulse was palpated at the fifth intercostal space, left side right at the mitral valve. Abdomen was inspected at eye level with good contour, was nice and flat. Color was appropriate for his race. No scars noted. It was symmetrical. No scars or striations noted. No visible peristalsis or pulsations noted, and his umbilicus was also midline. I also, vowel sounds present times all four lobes, tympany to percussion in all lobes, and negative to light and deep palpation through all lobes. Lower extremities were, his skin characteristics was nice and warm. He had good hair distribution. No edema or varicose veins noted at that point. All peripheral pulses from oral popliteal, posterior tibial, and dorsalis pedis were palpated. Full range of motion in his upper and lower extremities. Good muscle strength, upper and lower extremities with good hand grip. Heel to shin test was negative. Patellar reflex was positive at a 1+, and negative for a scoliosis screen. I would also like to add to the 15-year-old male for the head-to-toe assessment that lungs were clear to auscultation times all lobes, anterior and posterior. I also wanted to make sure you knew that the sclera was white, the iris was brown, and the corneas were assessed from the side with round and non-concave.